Now, your forecast first, sponsored by Matex Heating, Cooling, and Plumbing.
Well, temperatures tonight really falling. Kind of a cold night out there. It's already 33 in Champaign, 37 in Springfield, 40 in Effingham. And the winds, boy, those winds were just howling earlier today. But look, now those winds are much calmer, in between the 5 to 10 mile per hour range. So looking a lot better there. Clouds are on the increase here tonight. We're going to see a mix of sun and clouds tomorrow, but chilly temperatures definitely to start the day. We think we're going to be below the freezing mark here early on. And a freeze warning is in effect. We'll talk more about that. And I've got 2 chances for snow this week. I'll show it to you coming up. WCIA 3 News starts right now.
You're watching your local news leader. This is WCIA 3 News at 10.
Implemented those rules so we could have more attentive drivers and safer highways for everybody.
But now some of them don't apply as truck drivers deliver essential items during this COVID-19 pandemic. Good evening, I'm Paul Cicchini. Federal regulations for truck drivers were temporarily lifted by the president. The laws were intended to, of course, keep drivers safe. The hours of service law limits the amount of time a driver can spend on the road. Now that rule doesn't apply to those hauling essential items. WCIA 3's Jennifer Jensen has the story.
Truck drivers spend hours behind the wheel, often driving hundreds of miles at a time.
It's important to have a sharp mind.
The hours of service, or HOS, regulations were created to help ensure drivers stay vigilant.
Essentially, truck drivers have to get 8 hours of rest after 10 hours of driving, and so they can be ready and fresh to drive the next day.
During the COVID-19 crisis, the president temporarily lifted the hours of service law for those hauling essential items. The new exemption enables truck drivers to travel for longer periods of time.
In order to ensure that goods and services, critical goods and services, could be delivered to important places like emergency supplies.
Plus, the weight limit has been increased.
We're all trying to put more products in trailers so we can get more products delivered to grocery stores and more products delivered to emergency supplies.
Steve Gold with 160 Truck Driving Academy says there's an important history behind the reason why HOS regulations were established.
These laws were enacted to put rules around how many hours a driver can actually drive, how many hours he has to rest.
But in a pandemic, he believes these changes are beneficial.
I think everyone's concerned about the risk of everyone's health and safety behind the wheel, but I think just given the emergency needs across the United States, this emergency rule made a lot of sense.
Reporting, I'm Jennifer Jensen, WCIA 3, your local news leader.
These changes are, of course, temporary. When the president lifts the emergency order, the law will go back to the way it was. More than 500,000 workers in Illinois tried to file claims for unemployment benefits in a span of 5 weeks, and many workers are still trying to apply. The state has to design a new web system for self-employed contractors to apply, while it handles a record number of regular claims. It's processed and paid more than half of those claims. Today, the governor said the process for 1099 workers will be up in 1 month by May. Most coronavirus cases in Macon County are related to a senior facility in Decatur. The health department confirms 31 of the 42 people are tied to Fairhavens. It said tonight 2 of the residents have died. One, a man in his 80s, the other, a woman in her 70s. The CDC and State Public Health Department have guidelines for facilities after they've confirmed a positive test. They include ending all grouped activities, performing temperature checks for residents and staff, and limiting visitations to essential personnel. From the Department of Public Health now, new cases are up more than 1,000. That includes another 74 deaths. The total number of cases in the state is now at more than 22,000 and nearly 800 deaths. OSF is helping with the statewide launch of a new resource for COVID-19 patients. It's set up a telehealth service to do remote patient checkups and provide mental health support. People who have COVID-19 symptoms and need to stay home to quarantine can call the hotline to get set up with a health worker. They'll connect digitally on a daily basis for 2 weeks to help with recovery. They'll also deliver wellness kits that include essential tools to monitor a patient's health, including thermometers, blood pressure cuffs, and alcohol wipes.
Our pandemic health worker fielders go into the community. They put the package on the door, and then they go back to their vehicle, and then they're able to use that tablet or the electronic device that a client may already have in their home to communicate then. And so there's no physical contact with that client.
A person's eligible for the program if they show COVID-19 symptoms, are at high risk for contracting the virus, but do not require emergency or inpatient care, and can be digitally monitored at home. You have to call the hospital hotline to find out if you qualify. We have a link to that hotline at WCIA.com. Being a nurse is no easy job, of course, and doing it during a pandemic adds its challenges. We caught up with Teresa Green, who oversees the nursing staff at Carl. She says nurses are using creative ways to be safe while caring for their COVID-19 patients. One example is Carl has a special washing station for nurses to remove their scrubs and shower before going home. They also have housing options for employees who are worried about infecting their families. On top of that, nurses are being careful about how often they move from one area of the building to another.
We try to do everything that we can for the patient in that one time so that we're really conserving our PPE and making sure that we're limiting the number of times that we're having to go travel throughout a department, or making sure that we are using one mask for a shift.
Carl is still accepting N95 and cloth mask donations. The hospital asks everyone to follow CDC recommendations and wear a mask when you're out. People in Champaign County expressed concern because technicians at area blood centers have not been wearing personal protective equipment. Today, we spoke with Community Blood Services of Illinois to get some clarification. They told us they're following the CDC's most recent guidelines, which do not clearly specify employees at blood donation centers need to wear PPE. However, the Champaign-Urbana Public Health Department was in contact with Urbana's Blood Donation Center. The health department's new guidelines state donors and technicians must wear masks. The Community Blood Services of Illinois told us the #1 priority there is safety and following the most recent health guidelines in place.
There's a distinction that I don't think everyone sees, and we understand that there's a lot of stress and anxiety about what's happening around us, and it's confusing, and it kind of gets all of us a little bit riled up. But what we go from and where we base our decisions about policy and what staff are going to be doing is that specific CDC guidance.
As an added safety measure, blood centers in that network are no longer allowing walk-ins. Donations must be made by appointment, and everyone is screened to make sure they are not experiencing symptoms before they are approved to donate. Urbana police are still looking for the person who shot and killed a 15-year-old Saturday night. Happened on Philo Road between Michigan and Laurel around 6:30. Police say Terrace Pettis was shot while riding his bike. The teenager was pronounced dead at the hospital. Urbana's mayor says this was a group of teenagers who have a history of gun violence. She says this is a reminder to the community. This is a battle city leaders are facing.
Even though our everyday routines have just been swept away in the past month, all the underlying issues and challenges that we were dealing with a month ago are still there, and in many cases made a lot worse because of the lack of structure, the lack of school.
Police say there are no suspects in custody, and they're asking anyone with information, pictures, video to contact the department. Macoupin County officials are looking for a person who escaped the jail last night. They say William Kavanaugh went into a closet, crawled through the ceiling and out a second-story window. Video from outside the jail shows him walking south. Officials believe another inmate helped him escape. They say Kavanaugh is dangerous. If you know anything about where he is or what happened, call the Macoupin County Sheriff's Office or Crime Stoppers. Officials in 3 counties are looking for people who all disappeared within a week. The McLean County Sheriff's Office is looking for 31-year-old Tyler Graff from Downs. He was last seen Saturday morning. Authorities there had teams looking for him all weekend. They want anyone who might know where he is to call the number on the screen, 309-888-5034. They've continued to patrol that area all day. In Champaign, police are looking for a 23-year-old man who disappeared last week. They say Jeremy Wallace was visiting family. He left their home late Thursday night and was seen at a business near Kenwood and Springfield in Champaign. He left there and hasn't been seen since. If you know anything about that disappearance, you're asked to call police or Crime Stoppers. In Shelby County, police say it's been more than a week since 29-year-old Kimberly Mattingly disappeared. She was last seen April 5th getting into a blue car with a man. Authorities say her phone later pinged in Effingham, but there's no other evidence of where she might be. If you've seen her, call the Shelby County Sheriff's Office. You always see firefighters, police, and EMTs, but not one group. Why? They're just as important. Plus, you need to train if you want to be a police officer. how that's changing because of COVID-19. And spring sports are a no-go, but summer sports are also starting to be hit. Well, that's a blow to at least one athlete.